Welcome to the Deep Dive, where we sift through the sources and give you the essential knowledge shortcut to the topics shaping our world. Today, we are tackling what feels like the single biggest digital dilemma of our time. Is social media a poison or a panacea for young people?
It really is the central debate, isn't it? Dominating policy, parenting chats, everything. And the scale of it, well, that shows why. Our sources highlight just how deep this goes. Take India, for example. Smartphone use among kids aged 10 to 14, it's 83%.
Wow, 83%.
Yeah, and that's actually higher than the global average, which is around 76%. So for today's adolescents, digital connection isn't really an add-on. It's basically the air they breathe socially. Hard to imagine life without it for them.
And yet, when you dive into the research, you get such conflicting signals, right? Constant warnings about mental health crises on one hand, but then the actual empirical data often shows, well, maybe only modest links or these really complex interactions. It's hard to get a clear picture.
Definitely. It's noisy out there. And that's really our mission today for you. We want to distill the latest, most solid research on how social media actually impacts the mental health of adolescents and young adults. We need to get past just counting screen time. We're focusing on the specific risks, yes, but also the maybe unexpected benefits, and critically, the mechanisms underneath it all. What actually makes the difference?
Okay, let's try to unpack that complexity then, because it's clearly not just one thing. Social media, it feels inherently dual-natured. You've got significant risks, cyberbullying, privacy issues, mental distress. But the sources also talk about ethical uses too, expanding opportunities for real connection.
Exactly. Conversation, boosting self-esteem sometimes, even providing access to critical medical or emotional support information. It can be both things.
And that dual nature, that's probably why the old research models sometimes miss the mark, treating everything lumped together.
Precisely. When you try to combine all the different things people do online across TikTok, WhatsApp, Reddit, Instagram, you name it, into one single predictor of well-being, well, you lose all the nuance, all the accuracy. We really have to look at the quality of the engagement and maybe the intent behind it.
Right. And that usually leads to that distinction people make between active and passive use. Active users are creating stuff, liking, sharing. Passive users are more lurking, just consuming.
Yeah, that was the traditional way to slice it, active versus passive. And it was a decent starting point for analysis. But a lot of researchers now see it as a bit of a false dichotomy.
A false dichotomy? Why is that?
Well, because just knowing if someone is active or passive doesn't actually tell you why they're doing it. What's their goal? Like a student might be actively chatting with friends, but maybe it's just procrastination, right? And that could be adding stress. Or someone passively scrolling through photos might just be keeping up with friends' lives. Kind of low-stakes social maintenance. So the label doesn't reveal the impact.
Okay, so intent matters more than just the action label. If time on screen isn't the full story, and active versus passive isn't either, how do we start thinking about that quality or intent?
We need to shift focus. Instead of looking just at what the user puts in, like time spent, we look at what the platform puts out. We look at the design itself, the specific features. In research, we call these digital affordances.
Affordances, like what the platform affords you the ability to do.
Exactly. These are the built-in design elements, the buttons, the feeds, the counters that suggest and make certain actions easier or more likely. These affordances, they are what can amplify those developmental vulnerabilities that are just part of being an adolescent. And that's what we need to understand and maybe teach kids about.
Got it. So let's dig into that amplification. Starting with the poison side, the key risks that get magnified because of how these platforms are designed.
Okay, first stop has to be cyberbullying. We know the definition. Deliberate, repeated harassment using digital tools. And the consequences are just severe. We're talking profound anxiety, depression, feeling totally isolated, and sometimes tragically suicidal thoughts.
Yeah, the numbers on that are always incredibly sobering to see.
They really are. We saw one global survey, and it found something pretty alarming in one region, specifically India. 45% of kids there admitted to cyberbullying a stranger.
45%. That's huge compared to the global average.
It is. The global average was about 17%. And what's maybe even more concerning, nearly half, 48% in that study, confessed to cyberbullying someone they actually knew. That points to a really high level of aggression, maybe less inhibition online between peers, at least in certain digital spaces.
Wow, that's intense. Okay, so beyond direct attacks like bullying, what's the next big risk, that constant comparison thing?
Yes, social comparison. This is huge. Adolescents are constantly putting their own messy, real lives up against these, carefully curated highlight reels they
Right.
see online, especially what we call upward social comparison, looking at people who seem more successful, more beautiful, whatever. It's strongly linked to lower self-esteem, body image problems, and particularly for young women, it's often linked to disordered eating. The standards feel polished, permanent, and often, frankly, manufactured.
And that pressure to compare, it feeds into that feeling of FOMO,
Yeah.
fear of missing out.
That's like the engine driving so much of the anxiety, FOMO. It's this pervasive feeling, this worry that other people are out there having amazing, rewarding experiences and you're just not there. Social media absolutely fuels this because it's a constant, highly selective stream of updates. It creates this urgency, this need to stay connected, to keep checking. And that drives negative moods, feelings of inadequacy. We saw stats like 56% of U.S. teens feeling anxious or nervous without the phones. It gets physically ingrained.
And then there's the really basic physical stuff too, like just displacing other essential activities, sleep being a big one.
Absolutely. Displacement theory. Simple idea, powerful impact. Screen time pushes out other things vital for well-being, using devices right before bed. Strongly linked to poor sleep quality, feeling drowsy the next day. And here's a striking number. 36% of adolescents say they wake up at least once a night just to check their devices.
That's disruptive. That constant fragmentation of sleep must take a toll.
Huge toll on thinking, on emotional regulation, everything.
Okay, so let's connect this back to those affordances you mentioned.
Right.
How does the actual tech design take these normal teenage vulnerabilities, like being sensitive to what peers think, comparing yourself, and dial them up into real mental health risks?
Well, a big part of it is turning social life, which is usually subjective, into something objective, measurable, like a game. Take quantifiability. Features like likes, follower counts, those one-click reactions, they basically formalize your social status.
They put a number on it.
Yeah. Exactly. They make acceptance and rejection instantly quantifiable, explicit, public. And that dramatically amplifies an adolescent's natural sensitivity to social feedback. An awkward moment in person might fade, right? But online rejection or just not getting enough likes feels like a permanent score that everyone can see.
So the platforms themselves, just by design, are sort of amplifying normal anxiety.
The research strongly suggests yes. They monetize visibility and status. And that connects to another affordance: persistence and replicability. What you post can stay there for a long time, that's persistence. And it can be easily copied and shared screenshots, reposts, that's replicability, even if you delete the original.
Meaning mistakes can follow you around.
For years, a dumb thing someone did at 15 can be screenshotted and pop up again and again. It really heightens the stakes of normal adolescent trial and error.
And the lack of face-to-face interaction probably contributes too.
That's the affordance of anonymity or maybe low bandwidth. You don't get the full picture of the other person, their tone, body language, facial expression. That lack of social cues can lead to what we call online disinhibition. It just feels easier to be more extreme, maybe more aggressive, to troll, because you're not directly facing the impact of your words. So these affordances, they fundamentally change the risk calculation. They lower the cost of being aggressive while making the consequences potentially much longer lasting.
Okay, that paints a pretty concerning picture of the risks. But we said this was poison or panacea. Let's flip the coin. What about the panacea side? The benefits, the protective factors, the stuff that maybe gets less attention.
Right. And the biggest positive that comes up again and again is connection. Simple as that. Our sources show numbers like 81% of students saying social media actually boosts their sense of connectedness. It's a quick, effective way to get social support, especially when things are tough.
And what about identity? Adolescence is all about figuring out who you are. Does social media help there?
It definitely can. It provides spaces for humor, entertainment, self-expression, and, identity formation. Think about the affordance of editability, being able to craft your profile, choose your words, pick the perfect photo. It lets teens try out different facets of themselves, maybe express things they wouldn't feel comfortable saying face-to-face, all in a pretty controlled way.
That makes sense. And I imagine that benefit is even more crucial for some groups than others.
This is where it can be genuinely vital, yes. For marginalized groups especially. Think about LGBTQIA+ youth, for example. If they don't find acceptance or community at home or school, online spaces can be absolutely critical. They find people with shared experiences, acceptance, validation. It can really buffer the stress associated with being part of a minority group. Sometimes digital media provides a social lifeline that's just missing offline.
That's powerful. And it's interesting how we're now seeing efforts to leverage these very tools for actual mental health help, using the medium itself for support.
Precisely. Digital media has huge potential here because it's scalable, it's accessible, often low cost. It's a great tool for prevention efforts. We're seeing campaigns disseminating mental health education, trying to destigmatize mental illness. And interestingly, teens often report feeling more comfortable sharing sensitive stuff online, especially anonymously, than they would in person, things like self-harm or suicidal thoughts.
Are there specific examples of these kinds of digital interventions?
Yeah, some really innovative stuff is happening. There's work using advanced machine learning to try and spot patterns in language online that might indicate distress or suicide risk. And practical tools too, like the hashtag #ChatSafe guidelines, basically helping young people talk safely and responsibly about suicide online. Early research suggests these kinds of mobile apps and social media interventions using things like psychoeducation and peer support are definitely feasible, and young people find them acceptable, which is key.
Okay, so it's complex, risks amplified by design, but also real benefits and potential for intervention. That brings us to the path forward. Given all this nuance, all this rapid change, what's the best way to navigate it?
Well, first, we absolutely have to keep acknowledging the challenge around causality. The research, again and again, shows maybe only a small or modest link between overall social media use and mental distress. But figuring out which causes which is really tricky. It's almost certainly bidirectional.
Bidirectional meaning
That goes both ways.
mental health affects use,
Yeah.
and use affects mental health.
Exactly. It's often a reinforcing cycle. Someone already feeling anxious or depressed might go online more, maybe seeking connection or just distraction. But because they're already vulnerable, they might end up making more of those unfavorable social comparisons or get sucked into endlessly checking for validation that never really comes. So their pre-existing condition shapes how they use social media negatively, and that negative use then makes the anxiety or depression worse. It's a loop.
So banning it isn't the answer. It's more about equipping kids to handle the environment it creates.
That seems to be the consensus, yes. The most practical guidance really centers on digital literacy, and that means proper education for teens, sure, but also for parents and educators. It's not just about online safety rules like don't talk to strangers. It's about teaching critical thinking skills, how to evaluate what you see online, how to recognize unhealthy habits in yourself, like that FOMO-driven checking loop.
And presumably, having some structure around use helps, moving beyond just counting hours.
Yes, the idea of creating an individualized family media use plan comes up a lot in the sources. The real value there is it forces open communication within the family. It helps set clear boundaries maybe about what content is okay or when and where devices are used, like the classic example, no devices in the bedroom after a certain hour. That directly protects sleep and cuts down on that passive late-night scrolling that can be so draining. And crucially, parents need to model this too. Their own phone habits impact the kids.
Right. Okay, last piece then. The industry itself. If the affordances, the design choices are part of the problem, what needs to happen between researchers, clinicians, and the tech companies?
Collaboration is absolutely critical, but it hinges on transparency, which has been a sticking point. Ideally, you'd have researchers, clinicians, and the platforms working together to really understand the algorithms. Because the algorithms are what drive the affordances, what you see when you see it. Industry could play a huge role in promoting positive mental health messages, maybe even building helpful preventative tools right into their platforms. But to do that well, researchers need better access to more detailed, granular data from the companies. Without it, we can't really pinpoint who's most at risk or exactly how certain designs might be amplifying harm. We're kind of operating with one hand tied behind our backs.
That really lays out the challenge. So wrapping up this deep dive, the big takeaway seems to be social media isn't inherently good or bad. The tech itself is neutral.
That's the core idea, yes. It's those specific design choices, the affordances, like quantifiability, persistence, constant availability that interact with, and yeah, amplify the vulnerabilities that are already there during adolescence. Things like being extra sensitive to peer feedback, comparing yourself, maybe taking more risks.
Which suggests the most effective strategy long-term isn't just about blocking access or trying to constantly tweak the tech after the fact. It's really about shifting the focus, isn't it? Strengthening the adolescent's own ability to self-regulate, to think critically about the powerful social forces that the digital world magnifies. It's like teaching someone to swim in a strong current rather than trying to stop the river itself.
And that's a wrap on this episode of MedDecode. I really appreciate you joining me today. If something we talked about sparked your interest, or if there's a medical term that's been bugging you, let me know in the comments. And if you enjoyed this, be a pal and share it with a friend. We'll catch you on the next one.